I started off as a management consultant working with different service providers in terms of registrations, in terms of compliance, audits, midterms, renewals, and a lot of ongoing support in terms of compliance and operations to the bigger companies, obviously, that grew with us. And then we started, once Vertex 360 started, I've been with Vertex 360 since its inception, and I've been involved in everything related to the components, the
Hi
compliance,
Mel, how you doing? It's Zach.
the functionalities, and everything.
Good,
Yep.
thanks.
So I think, Cheska, if you can just mute, put a mute restriction so that there's no disturbance.
Let's see if I can
All
do
right.
that, Timur. I'll do that.
Yeah.
Thank you.
All right, no worries. So yeah, so then the purpose of having Vertex 360 was because we saw a lot of our clients that were using different softwares that were meant for different industries, or they were either very broad or very vague, being used in medical clinics. And so, all right, Gareth, I'm so sorry. I think everyone else can hear me. If you can maybe try leaving and joining again, that should work. Or if you can try checking if your volume or speakers are connected.
All right. Sound check.
Yeah.
Can you? I think
Yeah.
everyone can hear us except for Gareth.
Yeah. So Gareth will just give you a minute. So let's wait for her for a minute. You can log out and join again, and that should work. Let's do a quick rejoin then. All right. Yeah. Okay. Just in the meantime, so like I was saying, we started off Vertex 360 with this vision to make everything work together. So a lot of my clients personally would have one software for rostering. They would have one software for saving files, either OneDrive, SharePoint, or another third-party software. They would have another software for accounting. They would have another software for support coordination, another software if they had any allied health professionals at their company. So, okay, perfect. All good, Gareth. So, yeah, so a lot of companies were using 3, 4, 5, even 6 softwares at a time, and there was no sync in between them. So no different departments did not know what the other one was doing. There was duplication of work. The admin load increased so much that they had to lay off workers because the time it took to get something from one software to the other and then talk to this department and get it. So all of that was so hectic. And when the audits came, it became much more intense because when the audits come, you need to have everything together and ready to show to the auditors. And that's where a lot of my clients were panicking. And that's where we saw the gap. And then we put in and started building Vertex 360. And what it does is it keeps everything in one place so that your compliance, your operations, your invoicing, rostering, everything stays in one place and you have a clear picture of what's happening in your company. Now, a lot about Vertex 360. Let's jump into the topic we have today, which is psychological health of support workers. Now, what we've seen as the NDIS industry has progressed is there has been a lot of emphasis on participants. There has been a lot of emphasis on the companies who some have been in a positive light. A lot of them also have been in a negative light. And most recently, we've been seeing the news of different things happening throughout Victoria, New South Wales, Northern Territory, and other ones. So the main thing a lot of people were missing in this whole scenario was talking about participants, talking about the companies, talking about the management, but they were not really focused on staff. And staff is the uh, main gear of this whole process, because this is a very labor intensive industry. Everything that you do, all the services that you provide are very labor intensive. And if the quality of your staff and if the number or the frequency of your staff is compromised, it becomes a big problem for everyone. I'm sure if anyone agrees with me, they can raise their hand. Almost every support coordinator, almost every support provider has had problems with support workers, not retaining them, support workers leaving, starting their own companies, poaching participants. All of this has been happening with almost everyone. Uh, and the reason for that is because there is a huge psychological toll that comes into effect when you are supporting participants. A lot of times people see that when you are supporting a participant that might have a lot of physical disabilities, that would be taxing for the support worker to take them off the wheelchair, put them in the bed, or use harness. Sometimes they need two people. Similarly, you have participants who have behavior support plans, and they have very, very specific issues in terms of their behaviors. They might get angry, they might get agitated, they might throw something at the support worker. And being in that environment where you constantly have to look out for yourself, for your mental health, for the people around you as well, because when you're taking these participants into the community, there's also a risk that they might get into an altercation with someone in the public. So you have to cover all these aspects while you have to write the case notes, you have to talk to your supervisors, you have to report the incidents, you have to fill out the behavior of concern logs. And again, I'm not saying that the company, the management, and obviously the managers, supervisors are also doing a lot in terms of reviewing those incidents, seeing if they are reportable or not. They're doing filling out the registers. All of those things are being done. But the main person who is facing all of those incidents in first person is the support worker. And what happens if we keep their exposure of high risk activities for too long? It becomes a psychological risk. And this is the topic of today, basically, on how do we identify where psychological health of support workers can have an issue, and how do we rectify it, and what strategies do we use to make sure that it doesn't happen in the first place, and how you have proactive measures in place. Yes, Cheska.
Okay, Taymor, we have some questions that Mark and I will be asking you, if you don't mind,
Yeah,
on this
sure, sure.
webinar session. So, guys, by the way, the webinar session that we have right now is also more of a question and answer thing. So, so that we can just lighten up the conversation and it can be more interactive. But if you guys also have questions, um don't be shy. You could raise your hand. So, Mark, you have some questions with Taymor?
Yep.
Yeah, Tamer, speaking of this, what they call this psychological health for our support workers, why are we like suddenly hearing so much about this, about psychosocial risk in NDIS?
Yeah. So it started from Victoria, actually. So 1st of December 2025, the WorkSafe brought out new laws for psychosocial hazards. And those new laws, let me just take you through the basic definition of what it means, right? And that will give you an idea of how a company is supposed to take care of their workers, right? Basically, what they say is that a company is legally binding, has legally binding obligations on employees to manage psychosocial hazards. So employers must identify, assess, and control risks like bullying, harassment, high job demands, fatigue. And fatigue is the biggest gray area that you might have in terms of psychosocial hazards, because there's we will discuss this further on, but just to give you the definition, the employers have the responsibility of making sure that the employee is not fatigued. So if ever something happens to the employee or the participant, and during the investigation it is identified that the support worker was fatigued or had any psychosocial hazards that the company did not identify, they could be fined for up to $1.5 million. So yeah, in short, this is what the process is. Yes, I think we have a question. Yes, Naibana.
Thank you very much. I wanted to also ask if you, in the process, let us or share with us some of the strategies that your clients or your research about fatigue,
Yeah.
given that support workers work across different agencies,
Yes.
and you know what what uh, what is it that you need to do so that you are not being fined, if anything, for a collective fatigue from support workers, a number of jobs
Yeah.
with other agencies? So thank you.
Definitely. So it's a really good question. So it starts from your NDIS practice standards. So you might have seen during your midterm or renewal audit, your auditors might have asked you, how do you identify or where do you identify if your staff is working with another employer? You might have come across this question, is if anyone else can raise their hand if they've come across this question during their audits. So what they do is normally, yes, thank you, Cheryl. So what the purpose of identifying a second employer is to first identify if they're working with the second employer, and second is to assess if they are uh, physically fit, mentally fit enough to work their shift. So you also have to ask them if they, let's say, if you don't ask them, for example, the person has been doing a sleepover shift or a 12-hour shift with another employer, they come to you with for another shift, and they take out the participant, they're fatigued during driving, they just have you sleep episode, and they just crash the car. When the investigation opens, they see everything. They see, obviously, this person has been working with another company. They see case notes, timesheets. You know how NDIS asks for all these things once an incident opens. So it's not it doesn't take too long to identify what the problem was. Once you identify the problem, then the NDIS will come to you and say, what did you do to manage the fatigue of the employee? Second thing is your work safe. So work safe and all the corresponding organizations in different states, they will also come and say, how are you managing these things? Now, first part of your question was, how do we identify? So we identify through the worker screening registers, or where whatever system you are using to make sure you are identifying if the support workers are working with another company. Second part of it is proactive strategies. So recently I had the experience of sitting with the WorkSafe officer, and it was a similar complaint about fatigue uh, inside a company, and we were discussing different things, and a lot of things that the company had in place, and the reason why they got an improvement notice from WorkSafe was that they had a lot of things, employment assistance programs and this and that, but all of that was reactive. it would come into effect after the fatigue was identified. So if the support worker missed their shift, or if they said they have been burnt out, then they could go to employer assistance programs, or they could talk to their HR manager, or they could talk to their rostering officer.
Hey, Timur,
But
I
yep.
just wanted to check, is psychological safety just another compliance buzzword, or is it something that providers can no longer ignore?
Yeah, look, it's not a buzzword. Like I was just saying, it's not something you can ignore, because it can create a lot of issues in terms of, not just in terms of compliance, but in terms of
Mhm.
operational efficiency, in terms of financial efficiency as well. Because if you're losing support workers, if you're putting the same person on the same shift for too long, they leave you or they go to another company, the cost of hiring another support worker, training them, is also very high. Then the operational issue, you have to replace that person with another person. That support worker might be working with another participant who you have to take them off. And then you get another support worker to help that participant. So it's a lot of, it becomes a cocktail of issues, if you are not retaining your employees, if you're not taking care of their well-being. So, like
Okay.
I was saying, once having reactive approach versus having a proactive approach is how you can manage and identify and prevent having fatigue. So having things like your roster audits. So having once a month or once a fortnight, depending on the size of your company, you can sit down and see your roster. You can see if anyone has been doing shifts, consecutive shifts for more than 5 days. You can see if anyone has worked more than 38 hours, or if they have, in extreme cases, they have worked more than 48 hours during a week in 7 days. You can also see if they have worked more than, if during their shifts the break is less than 10 hours. You can also see if they are working more than 3 night shifts in a row, so sleepovers. So all of these things, if they start to happen in a pattern, then it becomes a problem, then it becomes fatigue. So if you are actively seeing, okay, this person, they've had, okay, this much work in this week and it's going to overtime. So either you assess if they are physically, mentally okay, everything is good. If there's an emergency, if not, then you should have an option of having other support workers who can manage the workload of the participant.
Okay, so
So,
can you give
yep,
me some common psychological hazards um in the disability services?
yep, yeah, definitely. So, some common things are, again, like I said, you're doing a lot of sleepovers. So there are some support workers who really like to do sleepovers. So they usually just take the work, which is sleepovers. So doing that in a lot of continuous days is harmful. Then you have a lot of people who like to do longer shifts. Uh, and then you would have people who are doing smaller shifts, but they have a very less gap in between. And then the thing that Nayabana said, they're working with multiple companies. That is the most important thing that everyone, I think, has to cater for and has to look out for, to make sure that the employees are not burnt out.
Just quick question. My name is Abdullahi. So
Yep,
I live in a regional town with a
yep,
population of 25,000.
yep,
So it's very common for staff to do back-to-back shifts here.
yep,
And there is a worker shortage as well.
yep,
Uh, so there's always not enough staff. And those are here, they're here to make the most out of their time. So they do back-to-back shifts. So they work
yep,
for me, they go to another shift tonight, and
yep,
then back to me, and then go another. So how, like, obviously they work for me like 5 days or 6 days a week,
yep,
example. So, and it's up to them what they do in the other shifts. So do I need to get some declaration or some sort where they
Yeah.
fill out second employment, and if I know that they do another work, so how do what is the approach here? And it's
Yeah.
very
So
common. All the providers have the same issues here.
yeah. I know a lot of, obviously, a lot of people who are in remote areas, a lot of companies, they have this issue, and it's very prevalent. The thing you can do is having, when it comes to NDIS and when it comes to anything that you're doing, there's obviously some restrictions, some constraints. How you deal with those constraints is how the NDIS or the auditors would perceive you. So everyone would know if you're in a town of population of 25,000 and there's a shortage of worker, any auditor or anyone who would talk to you would know there is a shortage. Now, if you don't have anything to show them on how you are managing that shortage, then it becomes a problem, which means that you are just going with the flow. You get my point? If
Yeah. So what sort of documents should I get myself ready? Should I have in place?
Yeah. So simple documents like we mentioned before, a worker screening register where you identify if they're working for a secondary company, you identify that. Second thing you do, if they're doing back-to-back shifts, after some back-to-back shifts, you should be doing some fatigue risk assessments, right? A small risk assessment, you see if they are feeling fine, if they're physically fine, mentally fine, all of those things to make sure that person is good enough, healthy enough to do a shift,
Yeah,
right?
something like more like a monthly basis. You can.
Yes. And then you could have like I said, an employment assistance program, or you can have some resources for your support workers if they get fatigued. Sometimes they don't want to talk to, let's say, Abdul, they don't want to talk to you because you might cut their shifts. You give them some options where they can vent out, where they can, talk to someone and they don't have the fear of losing out on shift. And this is also another thing you need to have is a proper policy, rostering policy, and a proper fatigue management policy where you've stated it very clearly that reporting fatigue to the company will not get you penalized, which means they will not lose shift, so they're not afraid of speaking out.
Yeah. So yeah, this is very good information actually. Would you actually drive in? Is there like a note of these of some sort that you will email or something? What needs
Yes.
to?
If after the webinar, you can get in touch with me and I can help you sort that out. Not an issue.
Okay. By
Yes.
email? I don't. How do I get in
Yeah.
touch with you?
Yeah. I'll ask. Mark is here. He will reach
Yeah.
out to you
Okay.
and we can get connected. No worries. All good. Yes, Mark.
Yeah, Tamar, I've been meaning to ask this. Speaking of, documentations and all, what are three things every NDIS provider should review this month?
Yep. Sorry. Can you repeat that?
Yeah, what are three things every NDIS provider should review this month if we speak of documentations for, to be compliant and to be audit ready?
All right. So three documents. If we put psychological health aside, I think we should keep it there. But one thing would be your rosters, making sure that there's no leakages in your rosters. They're being done properly. Second thing you should look at is your continuous improvement register. This is something that by far I've seen most of the companies are missing out on. So they get non-conformities during their audits because of small things that they have not identified in their continuous improvement register. Because the purpose of a continuous improvement register is to identify things, and when you identify things, which means you have proactively identified them, you're working on them. So the NDIS and the auditor sees that they can't give you a non-conformity for that small thing because you're already working on it. They didn't identify it, you identified it. And
Thank
the last thing I would say is your registers. So registers overall your incidents, complaints, your worker screening, your behavior of concern, all of these things help you a lot when you're applying for plan reviews, when you're going through audits, when you have an incident and the NDIS requests documentation or details, all of this comes in very handy at that time.
Hey Timur, can I
Yes.
just ask you, what are the new rules and regulations under the 2025 update on the psychological health regulations then? Can you give me some
Yep.
examples?
So, legal obligations, like I told you at the start, is for the employers to make sure that the employees are not fatigued, they're not being harassed, and they're not under any pressure. And
Okay.
this is also where you can introduce some trainings. So you can have trainings on harassment, on fatigue, on speaking speaking up, dealing with difficult situations. There's a lot of people who, if they are trained properly, they use those strategies to make themselves deal with situations better. So if
Okay.
I am with the participant and I think something that the participant says to me triggers me, and that becomes an issue with my psychological health. It happens again and again and again, and over time it takes me into depression or something, right? Similarly, when you have when you go through these trainings, it takes you through the strategies of how you de-escalate situations, on how you compartmentalize things. So when you know this participant what they're saying 5 minutes before, for after 5 minutes they'll completely change, and they love you, right? So these things you have to know how to let go, and these strategies how to use them. So this is also something that you can use to uh, minimize this risk.
And how about conflict or management behavior?
What do you mean by management behavior?
Like, is this high risk for psychological for like employees? Like, is this considered as well?
Yes. So basically, if the management is not being proactive in
Mhm.
identifying fatigue and identifying where the issues lie, then your approach will always stay reactive. So you will always be helping people or your employees after they've been through the issue, or after they've been fatigued, or after they've been through an incident. So
Mhm.
your job as an employee should be to proactively identify these issues. So like Abdul was mentioning, he has workers who are, and it's a they don't have any other option in case where they're in a remote area, they have to do shifts back to back. So the easiest thing you can do is talk to them, make sure they are doing okay, and as much as you can help them psychologically.
Tamer,
Yeah,
should you say that NDIS providers should be more reactive or preventative?
preventative. So being reactive gets you into a lot of trouble. If like I was giving you the example of this company, they were being reactive. They had these measures after things had happened, but there was no one proactively checking if the workers were having less than 10 hours of a break during their shifts, and they were not checking these sort of, if they were working more than 5 days a week. One of the support workers made a complaint against the company. So in this scenario, there was no external party that made the complaint. It was one of the workers. So you always have to be very careful. Sometimes you're trying to help the support workers because they need the shifts, right? And you're trying to help them, but sometime after, let's say 6 months, the relationship gets bitter, and they turn on you, and they go to WorkSafe, or they go to Fairworks, anywhere they can do that. Another thing is, if you actually think about it, if someone is doing overtime, your first priority should be, the company policy should be very, very clear, that the company avoids overtime at any cost. Because as soon as overtime kicks in, your not even profit, your margins are gone. So in many cases, you're going in negative if support workers are doing overtime. So your priority should always be to have a workforce where you have some backup support workers. May they might be casual, or whatever arrangement you have. You always should try to make sure, unless it is extremely necessary. Obviously, there's always outliers, but the general rule should be, the company policy should be against overtime.
Okay.
Okay, thanks, Tamer. Sorry, one
Thank you.
last thing. So we talked about compliance and all. Is compliance enough to keep support workers, the staff retention?
No. As much as I would like to say it doesn't. It's a lot of factors that you um, have to cater for. Obviously, this industry is something where a lot of support workers are not there because they're passionate. They're not there because they want to help participants. They're just there because they're getting paid, and you can't do anything about these support workers. So the most you can do is make sure that they're doing the right thing. For the
Okay,
people
Timur?
you actually have, who you think are doing the right thing, you should try to retain them. You should try to give them as much support as you can.
All right. Can I ask you something? So, if that in the case for compliance, how often should risk assessments be done in a year? And, you know, how should incidents involving staff trauma be handled?
So if we talk about staff, the risk assessments, there's no limit to how many risk assessments you could do.
Mm-hmm.
Risk assessments, either you could do one when you onboard a staff member, similar to how you do with a support worker, sorry, a participant. You could do with a support worker, like you do with a participant. So you could say, if you're working with another company, what is your schedule like? Is it flexible? How would you communicate with us if something goes wrong, if you're fatigued, if you're not feeling well? So all of these things, if you figure out the risk factors, do they have any history of depression? Do they have any history of, any psychological issues? So if these things you identify at the start, it would help you in supporting that support worker, and keeping them, retaining them long term as well. And
Oh,
similarly,
okay.
whenever they're doing, have a scale of what the maximum someone can do. If they're doing more than 5 days a week, if they're doing more than 38 hours a week, if they're doing more than 3 consecutive night shifts. So if they're doing all of these things, you should have an automatic trigger to do a risk assessment. And anything you identify in that risk assessment, you should have a mitigation strategy, a control assurance program in place.
Thank you. And one last thing from me. If a provider could just fix one thing this year to improve workforce stability, what should it be and why?
Sorry, your voice cut out a bit. Sorry, Cheska.
Sorry? Yeah. Can you hear me better?
Yep.
Okay, so if a provider could fix one thing, could prioritize one thing in terms of psychological health,
Yeah.
for workforce stability, what would it be and why?
One thing is keeping an eye on your rosters. That is where everything starts from. So when you're rostering, talk to your support workers, make sure they are fine, make sure obviously there's a lot of times where we have to fill shifts where someone drops out, uh,
Mhm.
and you are just trying to manage, you're trying to contain the situation. But when you're doing that, while you're doing that, just be mindful of your support workers as well. Ask them if let's say they're not just saying yes in pressure, they're not just saying yes because they have to, they are actually fit enough to complete a shift. So that is, I would say, the highest priority for me.
Okay. Guys, do you have any other questions for Timur?
Yeah, if you have any questions, please feel free to click the raise hand button and we'll acknowledge you, or you can type it in.
Right.
Okay.
Yes. I,
All right. Does anyone have questions? Okay. Timur, do you have any words for them so far? Any other tips before we end the webinar in a bit?
yeah, I think it was, I've spoken too much. It might have been information overload for a lot of people, but that's why they
Yeah.
don't have too many questions. So I think
Okay.
let's leave the questions to emails. Yes, Eve, uh, Maria, do you have a question?
Yeah, yes, I do. No, I'm not Maria, but it's Nyabana.
Yeah,
You mentioned something earlier that the improvement register is something that you see a lot of people being pulled out for.
yeah.
Do you guys have anything that has worked for your other client that you would be willing to share as part of this webinar? And thank you for highlighting all those issues, the rostering, particularly the risk assessment questions as people join the team and then doing those throughout the employment relationship. I found that very, very helpful
Yeah,
because people want to cover the bills as much as we love doing what we're doing. There are also elements, like you said, that people just wants to make money, and honesty doesn't always you know uh, happen at every minute of your working relationship. So yeah,
yeah,
that is my takeaway, to just keep protecting yourself. By all means, protect your staff, protect your participant, but the company also does have something that they can do to keep work safe. Work safe is very heavy-handed on employers. So yeah, thank
yeah,
you for
yeah.
that.
Definitely, no worries. And yeah, if Mark or Cheska will reach out to you after the webinar, and we can share a template with you, and you can use that to start working on your continuous improvement plan.
Oh, Ave Maria WHS has a
Yeah,
question.
yes, it was her before. Do you have another question?
Yeah, for the information of everyone, we'll be sharing with you the recording of this webinar. If you'll be needing as well the presentation for today's webinar, we can also share it with you. For more consultations and stuff, we can connect you with Tamar right here. And yeah, we can address questions as well. Just
Yep. So,
send us an
mhm.
email, me or Cheska, and we'll hope to connect with you. And we'll also wanted to invite you for our upcoming webinars. So stay tuned.
And also please be advised that if you need if you need something for help with rostering or any audit questions or any NDIS questions, feel free. I will be sending you the email of Timur so that we could help you out. Okay? All right. So that would be all. So it's a wrap today, Mark. So thank
I
you for
think with this,
attending the
we
webinar
we're
so
on
far.
time, I think. Yeah, 56
Yeah,
minutes. We didn't go too
yeah,
long.
we're actually on time today, but
New record.
this is actually nice because it's a lot of people asking questions, not just us. So
Uh,
I'm really, really surprised. So,
So
thank you
guys,
for
before
participating.
Yeah, before we close today's session, I would like to inform everyone a quick update of Vertex 360 that we're currently rebranding, undergoing an exciting rebranding to Supportly. As you can see, this is an NDIS compliance as well solutions. And over the coming months, you'll see, or weeks, see updates from us. So thank you so much.
Okay, that will be
No
all. All
worries.
right.
All
Any
good.
other words? That will
Yeah,
be
I
all.
think I'll just put my email into the chat if anyone needs it. And then after in the recap, Jessica, you can share my email with everyone as well.
Yeah.
And yeah, so it was really nice talking to all of you. And I'm really glad that all of you came out with your questions. This is how everyone learns when one of your experience helps another provider in making sure that they don't make the same mistake, they learn from it, and you also learn from the advice of others more experienced than you. So really nice talking to everyone, and we hope to see you in the next webinar. Thank you so much.
Thank you.